Health challenges remain a very major global concern. Yet we know that over 80% of these challenges can be prevented if communities are equipped with the right knowledge on disease prevention and they have access to quality health services. In Kenya today, our very key major mandate is to ensure that we are providing an available, accessible, acceptable, and affordable quality health care. But that does not come without a little push here and there, because change comes with its own issues. Already, we are rolling out our universal health coverage, and the one thing that we are doing is to ensure that every Kenyan has an insurance cover that is taking care of them. It is important that as we live here, this is not going to be just a conference. It is not just a meeting. It is not, you could have stayed in your places of work probably, but this is a show and a collective responsibility into where we want our nations to be. Prevention of diseases, promotion of diseases, and protection of the same. As we move forward, we are seeing emerging and re-emerging issues in society. Somebody has talked about jiggers. Maybe then it used to be too much, then subsided, and now such diseases are being seen in society again. So what really is going wrong? We need to ask ourselves those questions. You know, we are seeing re-emerging issues. In Kenya today, we have Mpox. And we don't live as an alien country. We live with our neighbors. The influx of people from one country to the other because of trade, relationships, we cannot stop it. But how we carry this conversation with the masses makes the whole difference. We have heard of Ebola in our neighboring country, Marburg in our other neighboring country. We are suppressing Mpox in our country so that we don't have a lot of people with the same. We are coming from a lesson-full stage when we got COVID, and it was so difficult to manage for many countries. But most importantly is, what do those lessons, how do those lessons help you move forward? Anywhere I go, I ask people, how many times have you washed your hands since morning? During COVID, you would even wave at somebody and you clean your hands. By the mere action of waving, you would think that the germs have already flown to your hands. So what happened? What changed? Have we slowed down in our action to tell the people to have risk communication, reaching the right people it is intended for? When you're doing health promotion, repetition is important. Impact of what you're selling is very important. But impacting is not just enough. We must sustain that impact. And the only way is to ensure that financially we have budgets that we have set aside that are geared towards doing this work. And equally, we have the people and the teams that believe in the vision and the mission of the same to achieve of the same. Furthermore, our collaboration with the private sector remains vital in ensuring the availability of high-quality medical products and technologies. I am seeing my good friend, Chair, who is lead in the health sector, private sector. And our collaboration really has given us a milestone, because you cannot work alone as government. You must be ready to collaborate with each and every person. I have heard about SDGs. When we talk about partnerships and collaborations, we will be advancing of the same. I also want to recognize the major institutions that makes it very possible, national treasuries, and the FLOCA project for the support that they have given us in facilitating the leaders who have come here today. Ladies and gentlemen, the global community is grappling with so many challenges as harmful practices that affect health, climate change, emerging communicable diseases, hunger, malnutrition, disasters, and economic instability. It is therefore imperative that we discuss how to strengthen multi-sectoral systems and enhance intersectional to prevent and respond effectively to these many, many challenges. We have the same problems across the globe. The only difference is the magnitude of the problems and the issues. We still have our countries where we practice open defecation. Maybe the magnitude varies from country to country. Poverty, limited education, and poor health services. So health promotion is at the heart of the universal health coverage, and it's very essential that we develop and implement policies, as I've said earlier, to address especially preventable diseases. If you look at most of the diseases that we have today, our hospitals are full because of diseases that can be preventable. In Kenya, we have come up with the Facility Improvement Financing Act of 2023 that any money that is meant for health programs must never be reallocated. It must stay in the health sector. Probably we need to go granular, that in that money that is meant for health, then we must have a percentage that is ring-fenced for health promotion. And that's why we are here today, because conversations must start from whichever space that we are in.